Hypertension, often called the silent killer, can present subtle but important symptoms, especially in the morning. For many, the early hours of the day reveal signs that something is seriously wrong with their blood pressure. Recognizing these morning symptoms is crucial because they may indicate dangerously high blood pressure that requires immediate attention. In this video, we will focus on 5 common morning symptoms that could signal dangerous hypertension. These signs often go unnoticed or are mistaken for everyday issues, but they can be warning flags for serious cardiovascular problems. From severe headaches and dizziness to blurred vision and chest discomfort, understanding these symptoms empowers you to seek timely medical care. Morning is a critical time for blood pressure spikes. Blood pressure naturally rises during sleep and upon waking as part of the body's normal rhythm. However, in individuals with hypertension, this morning surge can be exaggerated, putting extra strain on the heart and blood vessels. This heightened pressure can trigger symptoms that serve as red flags. If you or someone you know experiences these symptoms regularly in the morning, it's important not to ignore them. Early recognition and prompt management of hypertension can prevent life-threatening complications such as heart attacks, strokes, and kidney damage. Stay with us as we explore what these morning symptoms of hypertension look like, why they occur, and what you should do if you experience them. Taking action early could save your life. Symptom number 1: severe morning headaches. Severe morning headaches are one of the most common symptoms that may signal dangerous hypertension. Unlike typical headaches that might come and go during the day, these headaches often strike early upon waking and can feel intense, persistent, and unlike any headache you've experienced before. Understanding why these headaches occur in the context of high blood pressure is important for recognizing their seriousness. Blood pressure naturally fluctuates throughout the day, typically dipping during sleep and rising upon waking. However, in people with hypertension, this morning surge can be exaggerated, causing increased pressure in the brain's blood vessels. This heightened pressure stretches and irritates the vessel walls, triggering painful headaches. These headaches are often described as a dull, throbbing pain mainly located at the back of the head or around the temples. They may worsen with physical activity or when bending over. Unlike migraines or tension headaches, severe morning headaches linked to hypertension may not respond well to over-the-counter pain relievers. In some cases, these headaches are accompanied by other symptoms like nausea, dizziness, or blurred vision, indicating that the elevated blood pressure is affecting other parts of the nervous system. Ignoring severe morning headaches can lead to delayed diagnosis and treatment, increasing the risk of serious complications such as stroke or hypertensive crisis. If you frequently wake up with severe headaches, it's essential to consult a healthcare professional for blood pressure assessment. Timely intervention can help control hypertension and reduce headache severity, protecting your brain and overall health. In summary, severe morning headaches can be a critical warning sign of dangerous hypertension. Recognizing and addressing these headaches early is key to preventing further harm. Symptom number 2: dizziness or lightheadedness upon waking. Dizziness or lightheadedness upon waking can be a troubling symptom that may signal dangerous hypertension. Many people dismiss these sensations as simple fatigue or dehydration, but when they occur regularly in the morning, they deserve careful attention. Elevated blood pressure affects blood flow to the brain, which can cause these unsettling feelings of imbalance or faintness. During sleep, blood pressure naturally dips. But in hypertensive individuals, the transition to waking can trigger a sudden spike in pressure. This abrupt change can temporarily reduce cerebral blood flow, leading to dizziness or lightheadedness as the brain adjusts. The sensation may be more pronounced when you stand up quickly after lying down, a phenomenon known as orthostatic hypotension, which can coexist with hypertension. These symptoms are not only uncomfortable, but can also increase the risk of falls, especially in older adults. Ignoring repeated episodes may delay diagnosis and treatment, allowing hypertension to silently worsen and cause more severe complications such as stroke or heart problems. If you experience dizziness or lightheadedness regularly upon waking, it's important to monitor your blood pressure and consult with a healthcare professional. Early intervention can help stabilize your blood pressure, improve cerebral circulation, and reduce these symptoms. In summary, dizziness or lightheadedness in the morning is a significant warning sign of hypertension that should never be overlooked. Recognizing and addressing it promptly can protect your brain health and overall well-being. Symptom number 3, blurred or double vision in the morning. Blurred or double vision upon waking is a serious symptom that can indicate dangerous hypertension and should never be ignored. Vision changes are among the less obvious but most alarming signs that elevated blood pressure is affecting your body, especially in the delicate structures of the eyes and brain. When high blood pressure damages the tiny blood vessels in the retina or causes increased pressure in the brain, it can result in visual disturbances that often first appear in the morning. The retina is the light-sensitive layer at the back of your eye responsible for sending visual signals to the brain. High blood pressure can cause damage to the retinal blood vessels, leading to swelling, bleeding, or narrowing, a condition called hypertensive retinopathy. Early signs include blurred vision spots or floaters. In severe cases, vision may become double, or you might experience sudden vision loss. Since these changes often occur gradually, many people don't realize they have a problem until vision is noticeably affected. Another mechanism behind morning vision problems is elevated intracranial pressure caused by hypertension. High blood pressure can increase the pressure within the skull, leading to swelling of the optic nerve, a condition known as papilledema. This swelling disrupts the transmission of visual information, causing blurred or double vision, and sometimes flashes of light or temporary vision loss. Papilledema is a medical emergency that requires immediate attention to prevent permanent damage. The morning is a critical time because blood pressure tends to peak during early hours due to the body's natural circadian rhythm. This morning surge can exacerbate pressure on the eyes and brain, triggering symptoms when the body is least prepared to compensate. People with hypertension often notice these visual changes upon waking before the blood pressure stabilizes throughout the day. Ignoring these symptoms can lead to irreversible vision loss or signal the presence of more widespread vascular damage. If you experience blurred or double vision, especially in the morning, it is essential to seek prompt medical evaluation. Eye examinations, including retinal imaging and optic nerve assessments, can identify damage early and guide treatment decisions. Managing high blood pressure through medication and lifestyle changes can reduce the risk of vision problems. Regular eye checkups are also crucial for those with hypertension to monitor and protect ocular health. In conclusion, blurred or double vision in the morning is a significant warning sign of dangerous hypertension affecting your eyes and brain. Recognizing this symptom and acting quickly can save your vision and prevent serious health complications. Symptom number 4, nausea or vomiting in the morning. Nausea or vomiting upon waking can be a distressing and often overlooked symptom that may signal dangerous hypertension. While these symptoms are commonly associated with gastrointestinal issues, their occurrence in the morning, particularly alongside other signs of high blood pressure, should raise concern for underlying vascular or neurological problems related to hypertension. Hypertension can cause increased pressure inside the skull, known as intracranial hypertension. This elevated pressure affects the brain's vomiting center, triggering nausea and, in some cases, vomiting. The morning is a critical period for these symptoms to manifest, due to the body's natural blood pressure surge upon awakening. This surge can exacerbate pressure changes within the brain, leading to heightened nausea or vomiting episodes. In addition, nausea and vomiting may occur as part of a hypertensive crisis, a sudden and severe increase in blood pressure that requires immediate medical attention. During such crises, the risk of stroke, heart attack, or organ damage escalates, and gastrointestinal symptoms often accompany neurological complaints like headaches or vision changes. Furthermore, hypertension-related kidney damage can lead to the accumulation of toxins in the body, resulting in nausea and vomiting. Chronic kidney disease is a common consequence of uncontrolled high blood pressure and can subtly worsen over time before symptoms become apparent. Morning nausea or vomiting linked to hypertension is typically persistent and may worsen throughout the day if untreated. It is often accompanied by other symptoms such as headaches, dizziness, or visual disturbances, signaling the need for urgent evaluation. If you experience unexplained nausea or vomiting in the morning, especially with other warning signs of hypertension, it is vital to consult a healthcare professional promptly. Early diagnosis and management of hypertension can alleviate these symptoms and prevent further complications. In summary, morning nausea or vomiting may be a serious symptom of dangerous hypertension affecting the brain or kidneys. Recognizing these signs early and seeking medical care can be life-saving and improve quality of life. Symptom Evrurier 5. Chest discomfort or shortness of breath after getting up. Chest discomfort and shortness of breath in the morning are alarming symptoms that may indicate dangerous hypertension affecting your heart and lungs. These symptoms should never be ignored, as they often signal that high blood pressure is placing excessive strain on your cardiovascular system, potentially leading to life-threatening conditions. Hypertension increases the workload of the heart by forcing it to pump blood against higher resistance in the arteries. Over time, this strain can cause the heart muscle, particularly the left ventricle, to thicken and stiffen, a condition called left ventricular hypertrophy. This change reduces the heart's efficiency and can lead to heart failure, where the heart cannot pump enough blood to meet the body's needs. In the morning, as blood pressure peaks, naturally symptoms like chest tightness, heaviness, or discomfort may become more pronounced. Shortness of breath may occur due to fluid buildup in the lungs, a common consequence of heart failure. This fluid accumulation makes it harder to breathe, especially during physical activity or when lying flat. Many patients notice that these breathing difficulties are worse in the morning shortly after getting up because the body's fluid distribution shifts during sleep. In some cases, chest discomfort may be a sign of angina, which happens when the heart muscle doesn't receive enough oxygen-rich blood due to narrowed or blocked coronary arteries, a condition often worsened by hypertension. Angina presents as pressure squeezing or pain in the chest and can radiate to the arms, neck, or jaw. These symptoms are serious warning signs that require immediate medical attention. Ignoring chest discomfort or shortness of breath can lead to heart attacks, arrhythmias, or sudden cardiac death. If you experience persistent or severe chest discomfort or difficulty breathing in the morning, seek medical evaluation promptly. Early diagnosis and treatment of hypertension and related heart conditions can improve symptoms and reduce the risk of severe complications. In summary, chest discomfort and shortness of breath upon waking are critical symptoms that may indicate dangerous hypertension affecting the heart and lungs. Recognizing and addressing these signs early is vital for protecting your cardiovascular health and overall well-being. Morning symptoms, such as severe headaches, dizziness, blurred vision, nausea, and chest discomfort are more than just inconveniences. They can be crucial warning signs of dangerous hypertension. Recognizing these early signals allows you to seek timely medical care, preventing serious complications like stroke, heart attack, and kidney damage. Paying attention to your body, especially during the vulnerable morning hours, is essential for safeguarding your health. At Active Healthcare, we are dedicated to providing clear, reliable health information to help you understand and manage conditions like hypertension. Our goal is to empower adults over 50 to take control of their well-being with practical advice and expert guidance tailored to your needs. If this video helped you identify important morning symptoms of hypertension and inspired you to act early, please subscribe to Active Healthcare and tap the notification bell to stay updated on our latest health content. Sharing this information with your loved ones can help raise awareness and promote early detection. Remember, your health is your most valuable asset. Stay vigilant, listen to your body, and work closely with healthcare professionals to maintain a healthy, active life. Together with Active Healthcare, you can take confident steps toward a brighter, healthier future.